So in this video we're going to talk about spinal reflexes. And one of the simple spinal reflexes that is performed to test the integrity of the nervous system, it is the patellar reflex. So the patellar reflex is the one that it is elicited by tapping with a stretch hammer or reflex hammer in here in the patellar tendon, which is this. And when you are tapping on the patellar tendon, one of the things that happens is that you stimulate the Golgi tendon receptors that we have within this tendon, and this will send a signal, an afferent signal, into the spinal cord at the level of L3, L4. And then we will have this neuron connection or this synapse between the afferent neuron and the efferent neuron. The afferent neuron is going to be sensory, so basically it's going to sense the stretch as you're eliciting with the tapping of the patellar tendon. And then this synapse is going to send the signal or the action potential into the efferent neuron, which is going to be a motor neuron that is going to be innervating the spindle muscle fibers within the quadriceps, the extensor of the knee. So this is a short reflex. We have long reflexes and we have short reflexes. So this short reflex, it is important for, in this case, to testing the integrity of the spinal cord. And one example that I can think about when you try to assess the integrity of the spinal cord is, for instance, if someone has an automobile accident and the person get hit here within the lumbar area, something that it can happen as you hit the lumbar area, you might break one of these lumbar vertebrae, and then as you break this lumbar vertebrae, you can damage the spinal cord at the level of L3 and L4, and thus the person won't be able either to feel or to move anything from the knee and below. And the way to test is by tapping this patellar tendon to see if the person has a good reflex or not. If the person doesn't have a good reflex, you might have a motor damage. And if you use this part of the hammer and then you start scraping below the knee, the skin of the person, and the person cannot feel anything, of course the person has to have their eyes closed to test for this. But if the person cannot feel anything, you have damaged the sensory portion of the reflex. Okay, so in order then to perform this reflex, you will be having the person sitting comfortably, and the legs will be hanging. And at some point, there is no, apparently there is no input coming from the brain in short reflexes, but some people might do, they're very conscious of themselves. In that case, you can do two things to prevent the person from putting input of the brain into this reflex. So you can ask the person to do a math problem for you, or you can ask the person to either put their fingers like this and pull, or be doing this. So that will distract a little bit the mind of the person. So when you are tapping, you have to make sure that you tap just below the patella, because if you hit the patella and if it's an older person, you might break it. Or don't hit here tibial tuberosity, which is just below the patellar tendon. So you just do this tapping, and then you will see this extension of the leg over the thigh. Okay, so again, this is how it's done. So kind of not so intense hit into the patellar tendon, and then you have this. Sometimes you can have a very strong reflex, or sometimes you can have a very mild. But if it's very mild, either the person have a weakness within the spinal cord, or the person, if even it might be so conscious and it's controlling the extension of the knee. And in that case, like I told you, you have to ask the person to do a math problem, or to try to pull their hand, so it will be a better reflex for you to elicit. Okay, so this is all for this video.